Hello, everyone. In this presentation, we are going to talk about our internship experience at the Cooperativa Presentazione. I'll start with myself. My name is Harmehek, and I'm from India. I am currently pursuing my master's degree, and I plan to pursue my doctorate in clinical psychology after this degree. Now, I would like my colleagues to talk about themselves so that we can talk about the presentation after that.
Hi, this is Sahar Saburi. I'm currently studying clinical psychology and I plan to pursue my education into the doctorate level on clinical psychology and I'm going to pass the words to my teammate.
Hello everyone, my name is Gülsüm Öztürü. I'm from Turkey. After I finish my master degree, I want to work with immigrants in the clinical setting. Now Gaia will talk about herself and we'll start our presentation.
Hello everyone, my name is Gaia. I am Italian and I have a degree in psychological science and techniques. And I hope to graduate in September in clinical psychology. Then, since my interest in psychotherapy, I hope to enroll soon in a school of psychotherapy. So since we all introduced ourselves, we can start now the presentation. Cooperativa Progettazione is a social enterprise that designs, promotes, and manages initiatives aimed at the social integration of people with acquired disabilities. And for acquired disabilities, we refer to all brain damage caused by events after birth, such as, for example, brain injuries, strokes, and so on. All these events can then cause impairments on a cognitive, motor, emotional, and behavioral level. Cooperativa Progettazione offers rehabilitation activities that aim to create new life projects based on cognitive, social, and work rehabilitation. And to achieve this goal, it offers various services, mainly divided into categories. The first concerns social housing, which implements projects for autonomy, promoting homes controlled by health workers, while the second concerns rehabilitation and proposes a program for job reintegration and also a day center. We were assigned to the day center, which provides individualized rehabilitation projects that include educational, social, emotional, and cognitive labs, and also psychotherapy, speech therapy, and physiotherapy. So this was a general description of the institution in which the traineeship took place. Now I pass the word on to my colleague, who will speak more about the role of psychologists in this organizational setting.
Thank you, Gaia. Now I will talk about the role of psychologists on the organization. During the day, psychologists work mainly with two specializations for disabled people. The neuropsychologist evaluates the consequences of brain damage in order to develop the functioning profile of the patient to propose targeted interventions. Clinical psychologists are performing intervention plans together with educators and speech therapists, and also psychological support to family members and the patients. Now another slide. This is the mandate of the organization. The psychologist is preserving and increasing residual capacities and preventing further impairments. Also, they are improving patients' well-being and enabling re-socialization. According to our observations, we can say that psychologists follow these objectives and they are agree with this. Also, we can say also this is a positivistic mandate because there is an idea of well-being, there is an idea of socialization and impairment and the capacities that the psychologist has to preserve and improve. And now in the next slide, I'm talking about activities. Okay, in this organization, there are different activities for different severity of injury and functioning. When psychologists create an intervention plan, they usually decide the activities that are most suitable for achieving the objectives of each patient. These activities are cognitive activities, family support, speech therapy, ecological rehabilitation, individual sessions, and expressive activities. We had a chance to observe some activities, of course, during our internship. Some games which improve their memory, increase problem-solving abilities, and creativity. For example, word games, patient had to organize scrambled words into meaningful sentence or fill out an incomplete sentence with the best fit word according to their past knowledge. It helps to improve word recall and other functions in the brain. Also, there were playing card games such as Go Fish, poker. These can help to improve cognitive functions. Another slide, we observed in this center, everybody does everything. They are working collaboratively. For example, they have a schedule. While some psychologist or educator was doing activities, the other psychologist was cooking in the kitchen for lunch. So the positive impact of the multidisciplinary approach to activities is that the efficiency of these activities can be improved when specialists with different skills work towards the common objective. However, in the point of the negative consequence is the confusion that results with the approach because of no clearly defined specific roles of each specialist and their respective activities. Now, my colleague Harmek will talk about the epistemology part. Thank you for attention.
In this particular setting, the idea of mind and human is driven by the understanding that the patient's existence is not just determined by how they function, but also the kind of emotional, social, and psychological factors that surround the patient. So, the psychologists' belief about the human is based on the ultimate goal of well being. And in case of patients with brain injuries or impaired cognitive abilities, they try to enhance the patient's competencies with a transformative objective. So, they make an effort to re socialize these patients into the society. In the next slide, it talks about the epistemological aspect of the psychologist's functioning. The psychologist presumes positivistic objectives. So they try to find or understand the problems of their patients. And once they determine what is wrong or what needs to be altered, they try to use psychological interventions and activities to improve their patients' conditions in order to bring them more closer to their well being and healthy functioning. In the coherence part of the epistemological approach and the methods and activities adopted in the organization, the center carried out different kinds of laboratories such as cognitive and expressive. And the activities carried out in these laboratories are a way of stimulating the damaged areas of the brain while trying to preserve whatever cognitive skills remain in those affected areas. Or they may try to help the patients to acquire such skills to enable them for their social functioning. The basic idea behind all these activities is that a holistic approach to the individual's health is required to help them function properly. Since the psychologist understands the concept of well being, they try to work on each patient's deficient skills in an attempt to help the patients reach closer to their well being. Now, Sahar will talk about what the psychologist in that setting could do differently to ensure more fulfillment of their role.
Thank you, Armalik. As we came to conclusion that some things could be made differently in this organization. Since the positivist approach is the underpinning of most of the intervention, they were paying a great attention to transformative goals and trying to model the patients toward a performed health model. We think it can be also beneficial to use complexity approach for the interventions to allow patients to be given space and time to discover their own way of expressing of themselves without having to conform to a predefined idea of health. They could also add some more psychological interventions related to the discovery of oneself and one's identity in the face of a radical change in their living condition. There are some learnings that I'm through this experience that I'm going to explain in the next slide. Through experiencing this internship, we understand the importance of this multidisciplinary team, which were collaborating to achieve the objective of the patients. Regardless of the area of their intervention, the relationship was between patient and professional was the central focus of the therapy. In addition, empathy is the core of these relationships. We experience the real work setting and we get acquainted with psychological tools and assessment and observe the real interventions. During this experience, we faced several personal constraints that influenced the observation of us. First, we were emotionally incapable to relate with people with this kind of disabilities. And it was hard because we were facing the language barrier as three of us were not Italian. Lastly, our expectation from this internship was different from what actually we were experiencing. That's all, and thank you for your attention. I'm going to pass the words to my colleague.
Now, the four of us want to take the opportunity to briefly reflect on the learning from our experience. Personally, for me, one of the learning I take is that how important it is to engage with professionals and colleagues from other specializations to ensure that all the objectives and goals of one's patients' healthy functioning are met. I am sure Gulsum has something similar to share about her experience.
Yes, thank you, Harmek. For me, I can say this internship assisted me in understanding the importance of human social interactions, especially involving the disabled, to provide them with sufficient motivation and purpose to live a life free of instabilities and pressure. Gaia?
Yes, thank you, Gulsum. So one of the things that I noticed about the core competencies of the psychologist is the ability to connect with the subject, to create a relationship. As I was able to see during the internship, the relationship allowed the patient to feel comfortable in dealing with his or her disabilities, as there was no judgment on the other side. In fact, this was the one that most helped the patients to accept themselves, even in the new condition. So I pass the word to Sahar.
Thank you, Gaia. I suppose for all of us, that was an eye-opener experience, and for me specifically, it was really good and helpful to identify what I really want to pursue as my future career. The most important learning achievement for me was to understand the nature of the multidisciplinary professional team and their collaboration to achieve the objective of patients. I learned how to be more empathetic, and in addition addition, how to interact with other professionals and patients in an effective way. Thank you for your watching and your attention.